What is the medically necessary loophole in Medicare Advantage? Imagine needing a treatment your doctor recommends, but your insurance plan says no. That's what the medically necessary loophole is all about in Medicare Advantage plans. Medicare Advantage plans, also called Part C, are private insurance options that cover everything traditional Medicare does, plus extra benefits. But they can also set their own rules for what they will pay for, even if your doctor says a service is essential. This is often done through prior authorization, where the plan reviews and approves or denies coverage before you get care. The loophole comes into play when plans deny coverage for treatments they claim aren't medically necessary, even if your doctor says they are. They might do this to save money or control costs. For example, they can delay approval for a needed test or hospital stay, or refuse to pay after the service has been provided. Traditional Medicare has a clear definition of medical necessity, which means services must be reasonable and necessary for diagnosis or treatment. Medicare Advantage plans, however, can impose stricter criteria or requiring more paperwork. This can lead to delays or denials that wouldn't happen under traditional Medicare. The plans can also retroactively deny coverage after you've already received care, which can leave you with large bills. This is especially common with hospital stays or specialist visits. The plans might argue the service wasn't medically necessary according to their rules, even if your doctor disagrees. Recent rules from the Centers for Medicare and Medicaid Services aim to fix this. They now requiring plans to honor prior authorizations once approved and limit their ability to deny care after it's been given. They also say plans must notify both providers and beneficiaries quickly about coverage decisions. In the case of health maintenance organization plans, which often need referrals and prior authorizations, this loophole can be especially impactful. These plans usually restrict which doctors you can see and requiring approval for specialist visits or hospital stays. Preferred provider organization plans offer more flexibility but still use prior authorization processes that can lead to denials. So, even with more provider choices, the medically necessary loophole can still cause issues. Understanding this loophole is key when choosing between traditional Medicare and Medicare Advantage plans. While Advantage plans often have extra benefits and lower costs, they can also create hurdles to getting the care your doctor recommends. The recent regulatory changes are meant to protect beneficiaries by making sure once a service is approved as medically necessary, it can't be arbitrarily denied or revoked later. In simple terms, the medically necessary loophole lets plans deny or delay coverage for services that are needed, mainly through prior authorization and management rules. This can make it harder for you to get the care you need, but new rules are working to make the process fairer.